Hi, I'm Vasiliki Antoniadou. This is my nursing license and my patient consent form.
Hello, my name is Vasiliki. I'm with your nurse today. Hi, what brings you in?
I have been experiencing a headache.
Okay, and what's your name?
Ham,
Okay, how old are you?
26.
26, and what's your date of birth?
7/27/93.
Okay, and what race do you define as?
Caucasian.
Okay, and how about, I'm sorry, I forgot to, did you mention your sex?
Female.
Female, okay. What's your marital status?
Single.
Single. Any kids?
No kids.
Okay. Any hearing or visual deficits that we should be aware of?
No.
No, okay. You mentioned that you were having a headache. Where is the pain at your head?
I would say like more in the front.
Okay. And on a scale of 1 to 10, 10 being the worst, how bad is the pain?
Like a 6.
6. Okay, can you describe the pain for me?
Yeah, it's like a throbbing, aching kind of pain.
Okay. And have you noticed that it happens at a certain time of the day?
Yeah, like in the mornings when I wake up.
Okay. And was it gradual or did it just happen all of a sudden?
Like it's been happening for a couple weeks now.
Okay. Anything you notice make you feel better or worse?
Getting more sleep.
Mm-hmm.
You know, I feel like when I don't sleep enough, then like the headache comes on.
Okay.
But if I get enough sleep, then I think it's okay.
Okay. Do you use any medication to help alleviate that pain?
Yeah. Sometimes I take like over-the-counter medications like Aleve.
Okay. And you notice that helps?
Kind of.
Okay. Any other symptoms along with that headache? Do you feel any nausea?
No.
Anything in any pain in the eyes?
Mm-hmm.
No. Okay. Past medical history wise, do you have any diagnoses or illnesses?
No.
Any surgeries in the past?
Mm.
No. Are you allergic to anything?
Mangoes.
Mangoes. Okay. Any other medication?
No.
Okay. Are you up to date on your shots?
I am.
Okay. And your family history, mom, dad, brothers, sisters, uncles, aunts, grandmas, anybody have anything diagnosed? Any illnesses?
Yeah. My mom has high cholesterol.
Okay. When was she diagnosed? At what age?
Like in her 40s.
40s. Okay. And is it under control?
Yeah, she's taking Lipitor.
Okay. And how about anybody else in the family?
My grandmother had diabetes.
Diabetes. Okay. Type 1 or type 2?
2.
Type 2. Okay. And how did she manage? Was it under control?
Yeah, she was seeing an endocrinologist for it.
Okay. Was she taking any medication for it?
She was taking insulin.
Okay. Just pill form, do you know?
I don't recall offhand, to be honest with you.
Okay, that's okay. And social history-wise, do you smoke?
No.
Do you drink at all?
Nope.
Do you use any drugs?
Nope.
Okay. Do you use any kind of sunscreen whenever you're out?
Yeah. I have like a natural like lotion that has SPF in it.
Okay.
So I wear that every day when I go out.
Do you wear? I'm sorry.
Very fair skin.
Okay. Do you wear a seatbelt at all whenever you drive?
I do.
You do? Okay. Helmets whenever you ride bikes or anything?
Yeah.
You do? Okay, great. Now, generally, have you noticed that you've lost any weight recently or gained any weight?
Not really.
No? Felt anything, fatigue? Notice that you've been getting really tired? No?
No.
Okay. How about?
I feel fine just besides the headache.
Okay, that's good. Not for the headache though, I'm sorry. How's your skin? Have you noticed any rashes, any moles that are uneven borders, different colors, any skin lesions?
No.
No? Okay, do you check your skin regularly?
I do.
Okay. And how about your hair and nails? Have you noticed that you've been losing more hair or that your nails have become more weak?
I would say my hair's thinning a little bit.
Okay. Was this recently or?
No. I think it's hereditary, maybe. I don't know.
Okay. All right. Now, have you noticed any headaches aside from whatever you had? Have you had headaches in the past? No.
This is something new.
Okay. Any head injuries?
No.
Okay. And then how about dizziness?
No dizziness.
No dizziness. Okay. How about your vision? When was the last eye exam that you've had, if you've had one?
6 months ago, and I have no vision issues.
No. You don't wear contacts, glasses?
Okay.
Any blurriness, double vision, itching of the eyes,
No.
drainage of the eyes?
No.
Okay. How about your ears? When was your last hearing exam if you had one?
Maybe about 3.5 months ago.
Okay. And everything was okay?
Yeah.
All right. Do you notice any sort of ringing of the ears, ear pain? Have you had an ear infection recently?
No.
No? Okay. How about your nose? Any kind of drainage?
Maybe like seasonal. You know,
Okay.
sometimes I get a little itchy.
What's the color of the drainage though? Is it
It's clear.
It's a clear drainage. Okay. Any kind of have you ever tried maybe trying to block one nose, trying to see if there's any blockage? Maybe you can breathe out of one nostril better than you can the other.
No, I think it's pretty equal on both sides.
Okay. How about your mouth? Do you have any sores?
No.
No. Have you had any surgery for your mouth at all? Wisdom teeth removed?
No.
No. Any pain?
No.
How about your throat? Have you had a sore throat recently?
No.
Any soreness?
No, sorry.
No infection?
Sorry for my own.
You're okay. It's okay. Now for your neck, do you feel any kind of lumps around your neck? Have you noticed maybe your neck's been a little bit bigger over here? No. Any stiffness in your neck at all?
Not really.
Okay. How about your lungs, respiratory wise? Have you noticed any shortness of breath?
No.
No. Any diagnoses or anything in the past, such as asthma or maybe TB?
Nope.
No. Any cough?
No.
Okay. How about your heart? Have you been feeling any chest pain?
No.
No chest pain. Okay. Any sort of swelling in your feet?
Maybe after a long shift.
Okay. What do you do? Where do you work?
I'm a nurse.
You're a nurse? Oh, that's nice.
Yeah.
Okay.
I work at DMC downtown.
Mm-hmm. Now, do you have your bachelor's or your associates?
I'm working on my bachelor's.
Working on your bachelor's. Okay, that's good. It's a good thing you went back. So you said after a long shift, you feel a little bit of swelling in your feet. Okay. And have you noticed any kind of, like, your heart's racing sometimes?
No.
No? Okay. Have you had an EKG or stress test done?
Yes, last January.
You did? Okay. And how was it? How were the results?
No.
Everything was okay? All right, very good. Now, I did mention the swelling in your feet. Have you noticed any kind of, what we call edema is the swelling, but have you noticed anything with your veins? Your veins been more defined?
No.
You may be holding a lot more fluid.
Veins,
no? Okay. And then how about your appetite? How's your appetite been?
It's okay. Normal.
Normal?
Regular.
Okay.
No recent changes, I don't think.
No? How about any stomach pain, nausea, vomiting?
No.
Okay. When was your last bowel movement?
Yesterday.
Yesterday, okay. And how was it? Was it like a normal for you?
Yeah, normal, like no.
What is your
changes.
normal? What is your normal?
Just regular brown.
Okay, that's good. Yeah, it's a little difficult to talk about this kind of stuff. I understand.
Oh, I'm a nurse.
Okay,
Trust me,
yeah.
I ask people this stuff all the time.
Okay. Now, have you had any? You said no pain or discomfort in your stomach, correct?
No.
Okay. Now, urinary wise, have you had any burning, itching, been peeing a lot, maybe seeing like whenever you do urinate that you need to more dribbles afterwards? Do you feel like you need to urinate right away at that moment or if it's urgent?
I don't have any issues.
Any UTIs recently?
No.
No? Okay. Now, I'm going to talk about your genitals for a little bit. I do apologize, but have you noticed any burning or itching? No. And when did you get your period? At what age?
16.
16, okay. Now, when was your last period? I'm sorry?
Last month on the 23rd.
23rd.
So I'm due soon.
Okay. How long does your period usually last? How many days?
Like 4 days.
Okay. And pad-wise, do you feel like you bleed heavily?
Not really.
Okay. So are you a heavy bleeder with your periods?
No.
No?
Not
Okay.
usually.
Are you sexually active?
I'm not.
No? Okay. Now, for your bones-wise, do you feel any kind of pain in your back? Any, maybe in your legs, joints, any stiffness in the morning?
Maybe some ankle stiffness.
Okay.
Because I used to play basketball.
Alrighty.
So I think the effects of basketball took a toll on me now that I'm not so young anymore.
You're still young. That's okay.
Yeah, that's it.
Okay. Now, for whenever you have the headache you mentioned, now do you feel like you've had any memory recall issues?
No.
No. Have you had any troubles with like numbness, tingling in the fingers, any sensation?
Mm-hmm.
No.
Mm-mm.
Okay. Any blood disorders that if we had a transfusion in the past, maybe?
I have not, and I don't have any disorders.
No. Any bleeding? So bleeding tendencies could be just if it's hard for the bleeding to stop, if it takes longer. So let's say if you cut your hand or you cut your finger, does it take a while for it to stop bleeding?
No.
No.
A couple minutes, it's right back to hemostasis.
Hemostasis. Okay, that's great. Now, do you experience any kind of heat intolerance or cold intolerance?
No, not usually.
Do you feel like you sweat a lot usually? No. Have you noticed any excessive hair growth?
No, thank God.
No. Okay. Do you have any hair on your body, face? Nothing.
I mean, I have hair on my body,
Okay.
but not like an excessive amount.
Okay. Is it kind of like that light color?
Yeah.
Okay. We'll take a look when we do the physical exam for you. Stress-wise, mentally, how do you cope with stress? Because nursing can be pretty tough. So how do you relieve that stress?
Like exercise and just like, you know, hanging out with my friends and venting.
Okay. That's very nice.
Yeah.
It's good you have friends to talk to and go over some stuff. Have you been feeling any loss of interest in activities that you normally do, down, depressed?
No.
No? Any thoughts of hurting yourself? No? Okay. All right, well, I'm going to go ahead and do a physical exam on you, and then the doctor will take a look at your chart, and we'll go from there.
All right.
All righty?
Thank you.
You're welcome.